The wonders of the world are first encountered through the eyes of a child. Yet, without good vision, a child's ability to learn about the world becomes more difficult. Vision problems affect 1 in 20 preschoolers and 1 in 4 school-age children. Since many vision problems begin at an early age, it is very important that child receive proper eye care. The human visual system is designed with the idea of binocular vision. When we see an object, its image go to the retina, from there to brain. Brain shuts down image from weaker eyes. Here, two distinct images are seen with two different eyes. Kettle on the left side is without the handle, the right side it is with the handle. One has to fuse this. This function is done by the brain. If any of the eye is weaker or deviated from its normal position, the signal is shut down. Brain does the function of binocularity. It fuses the images of both the eyes. Here, one eye is seeing this cloud. If there is any false image or false signal goes to the brain due to the refractive error or some other reasons, brain cannot recognize it, which consequently give rise to amblyopia. Left side there is a house and right side there is a clown. These two images are seen differently by the two hotspot or fovea of the eyes. With sensory fusion, these two images are fused, 1 tree and 2 childs. If the eye is wandering or deviated or what is known as squinting eyes, it cannot be fused. So one eye remains unused, giving rise to amblyopia. One has to take care of these things in the early period of life. One has to see the stars, moons with both the eyes. God has given us 2 eyes to see or to have a binocular vision. If the binocularity is affected, amblyopia develops, which is also known as lazy eye. It is a reduced vision in an eye that has not received adequate use during early childhood. Stereopsis is finest grade of binocular vision. With the disparted images of the retina, depth perception can be achieved. This is only possible when there are 2 eyes. Now amblyopia can be manifested, or eye problem in children can be manifested in different ways. Here this child came with us with the problem of wandering eye or squinting. She has a strong family history of eye problem. Her mother is amblyopic. Her eye movements are full. Eyeball is a bit larger. Eyes are deviated outwards, which is known as divergent squint. On proper examination, she was found to have high myopia. The ocular movements are full. Apparently there is no gross abnormality except those wandering eyes. With spectacle, her vision was normalized. It came up to 6/12 with -3. Now she is waiting for surgery. She was diagnosed at early age, before the critical age is over. Here again, these twin children came with abnormal posture while reading. One of them came fast. When inquired about other children, the twin also came for examination. This is the typical posture what they were using during viewing television or studying. Squeezing of the eyes or keeping the books closer to their face. When examined thoroughly, they were found to have high astigmatic errors, and they were suffering from what is known as meridional amblyopia. As the refractive error was not corrected earlier, they were having their eyes lazy, amblyopic. They were given proper care and improving. These were the postures which are now totally corrected. This man, an electrician by profession, in early 20s, he never knew what the world looks like before he came to us. He had some sort of problem, dimness of vision or some sort of this. He was working on electrical mains. On examination, it was found that he was having this -18 power. Now you can imagine how safe we were in his hand. We were running the risk of short circuit. After treatment, he is improving. This is through the glasses, through his glasses, -18 diopter, what vision he could have, what signal the brain was having. This man, young man, was having nystagmus, wandering movements of the eyes. He cannot fix. This problem was detected when he was young, but these are the difficult cases. Glasses were given, still the nystagmus movements were not so reduced. There was no null zone. Girls often feel shy of using specs, so they suffer more. There are different other manifestations of refractive errors in children. Actually, children are ignorant of the fact that they are not seeing properly. The parents, teachers, the elders have to take care of them. Here this patient was having recurrent redness, blepharitis and burning sensation. Even some doctors are also not aware of this fact. This lady doctor had daughter with amblyopia. Eye checkup should be started in tender age. See the posture of the boys, children. This girl had congenital esotropia. She was taken care of. Her parents were conscious. They brought her here and her amblyopia and squint was corrected. She is still undergoing anti-amblyopia treatment. So if we treat the patients during the critical age, that is before 5 to 9 years of age, we can get good results. Contact lenses are useful in anisometropia. Occlusion of the healthy eye is the treatment of choice in case of lazy eye. Occluder can be of different types as shown here. With occlusion, reinforcement of the lazy eye should be done with some home exercises. This gives better results. Here this child is doing some matching work with color matching with her healthy eye occluded. These are very helpful. Even viewing television can be helpful to this amblyopic. Just put a red and green cellophane paper over the screen and use a red-green glass in the form of some toys or mask like shown here. These are part of active vision therapy which was found helpful in this study. Coloring of pictures, cartoon characters, these are again very useful. Computer games, children are very fond of it. These are again can be improvised. Flashing with synoptophore, alternate flashing of the lazy eyes. That is again helpful for the treatment of amblyopia. Hedinger brushes are another available form of treatment. However, these are not available in all cities. Still, whenever available, we should take the opportunity. Exercising on synoptophore, but it is not available everywhere. So, one should have based on other methods available. Boys are exercising on synoptophore. There are other different methods like cam stimulator. This was found to be helpful where the vision is very low or the patient is very young. We have done in many cases with successful stories. This girl, one of the girls had trauma in her childhood and she was having cataract with divergence squint. She was operated for that and given exercise on this cam stimulator. Her vision is now improving. However, the early diagnosis and proper treatment before the critical age is most important. Our motto should be early diagnosis and prompt treatment. With the urbanization, we are gradually becoming confined to different places. Our vision becomes obstructed. So here lies the importance. These are the different slides showing different gratings of cam stimulator. Urbanization has given rise to different visual errors. Children becomes confined to four walls. Their vision are regularly obstructed. They will be encouraged to go outdoors, play outdoor games. They should try to look beyond the horizon so that we'll get healthy eyes. Stop. Patching, patience and prayers. These were found to be the 3 P's for the treatment of amblyopia. Educate. If your child is old enough, explain the seriousness of her vision problem and consequences if not following the prescribed treatment plan. Let them play, let them enjoy, let them be outside, let them enjoy the greenery we have, let them enjoy the universe, the vast universe with their healthy eyes. But as elders, we should take care of their eyes because they are really ignorant of what they are seeing. Let their home be beautiful as this universe is.